doing the staff scheduling and making sure that you had enough staff with the right competencies and skills that, to match the patient population, I would have to log into probably 6, 7 different systems. Nothing talked to each other. I was constantly chasing my tail with dealing with understaffing. So, and understaffing equates to worse outcomes and not the best patient care. So if we can optimize that and have the augmented intelligence to help the nurses and nurse leaders make sure that they have the proper amount of staff so that staff don't get burned out and that patients are receiving the best quality care. I think that's a big win. That's another big win.
All right. Hey, everybody. Welcome to another episode of AI Got This. And we have the privilege of talking to Heather and Eric today about AI in healthcare. And I know we did a session on healthcare a couple months ago, but it was primarily focused on sort of the back of the house in a healthcare perspective, right? Operations and maybe finance and how AI can help there. And today we're going to talk about the front of the house and how the healthcare professionals themselves are either utilizing or would like to utilize AI in different ways that we maybe haven't touched on so far. So Heather, why don't you introduce yourself, and then Eric, you can introduce yourself, and we'll get started.
All right, sounds good. Well, thanks for having me on today. So my name is Heather Hudnall, and I am a nurse. I started at the bedside. I've been a nurse for about 17 years now, but I've spent the last decade on the healthcare IT side of the house. And what really drove me to leave bedside nursing is, everything you're still hearing today with overburden, burnout, but the technology was a big frustration for me at the bedside. So that's what me to dive into that world so I can help, provide input to make the technology work better for those that are delivering care at the bedside. So love this topic, and I am so grateful that you guys brought me on today to give the frontline perspective.
I'm so excited about this. Eric, I know you've been on before. We always love having you. Can you reintroduce yourself, though, just for everybody?
Sure. My name is Eric Shuss. I'm one of the architects and a director here at Armanino, life science industry analyst, and worked basically. AI is my passion my whole life. Very excited as AI is really kind of coming into the mainstream and really getting useful. And just because of my past experience in healthcare, talking to Heather, working with Heather on some things, I think there's just a really amazing time that AI is really going to start getting in people, helping people in the patient experience and all the healthcare workers' experience as well. So looking forward to talking about it.
Yeah, awesome. Okay. Well, let's dive in a little bit. Heather, maybe you can start by saying, talking a little bit about, you mentioned you sort of moved over to the IT side of the house to think about technology and how that can help from a bedside perspective. So what are you all thinking about, or what have you implemented so far that is sort of, getting you to feel better about that?
Well, Eric, can we share with them projects we've been working on together?
Absolutely.
Wonderful. So one of the big issues I always had working at the bedside, if you guys ever heard of the WOW carts, the little workstation on wheels that you'll see, the little computers, those used to have problems all the time, but it was never easy to submit a ticket. We didn't have time because nurses just are so busy. So if you walk on the unit, you would see what we called the WOW cart graveyard. And then once we didn't have any working WOW carts, we'd end up, making frantic calls to IT, and they'd come up and we didn't even know you guys had any broken WOW carts. Like, well, we don't have time to submit tickets, but now we're in desperate need. So I've been working with Eric to what I like to call it the easy button to submit a help desk ticket, and leveraging AI and automatic workflows so that we can avoid having the WOW cart graveyard, and so that nurses and any providers taking care of patients always have the tools they need to deliver safe care to patients. And the great thing about having those WOW carts is you can actually roll them into the patient rooms and spend more time face to face with them versus sitting out at the nurse's station and taking time away from that face to face interaction.
Yeah, that's awesome. And Eric, I think we talked about this a little bit, or at least you and I have, but maybe you can sort of say what does the easy button do?
The idea is to give people the ability, especially healthcare workers, just as Heather said, doctors, nurses, everybody is so busy. They're saving lives. And when you go to use that computer and the monitor doesn't work, the screen doesn't work, the scanner, if you're, whether you're using, even all machines, MRI machines, any kind of piece of equipment like that is so mission critical that if it isn't working, they don't really have time to go, oh, I'm going to go over to this other computer and I'm going to put in a service ticket and I'm going to type in what's wrong with it while a patient is in need of care. So one of the things that I work with Heather on is the concept that what if there was an easy button? What if all they had to do was basically go to that machine, and if there's a problem, you basically have a device that basically has colored lights. And if there's a problem, I hit the red button, a little red light goes on, and automatically it can do two things. It can create a service ticket to the service system, service like ServiceNow, D365 Asset Management, and automatically create that service ticket. Say, here's this piece of equipment. This is the WOW cart. I know what equipment is on it. Now I have a serious issue now. Create a service ticket without having to do anything other than that. IT, or more importantly, one of the things about in healthcare is each piece of equipment may be serviced by a different department or by the manufacturer themselves. So who needs to be alerted when this needs to be fixed isn't always the same. But if I can push that button and automatically whoever needs to be alerted is automatically alerted with not having to do anything, now a technician can actually walk in and look down that hallway, see the graveyard of WOW carts. Hopefully we won't have that anymore, but see the one that has the red light, go, oh, I need to fix that, repairs it normally, and then just pushes the green button, and now it's back online. If the person pushes the yellow button, it says there's something wrong with this piece of equipment, but it's still usable. So if someone sees a WOW cart, there's something wrong with this one. That one's got a red light. I'm not using that one. That one's got a yellow light because I don't have one of the green light right now. And that's the concept. And now the way we add AI to that is we can actually put an onboard AI edge chip in it. So you can actually now push the button and it can ask, would you like me to create a service ticket or would you like me to help you diagnose it? Because now we can use the information off of the chip local AI edge. So even if the Wi-Fi is down or whatever's down, it can do some basic diagnostics for you if you want to, if they have the time. If not, it can also go out to now the large language models and the different information and start to give diagnostics. The last time this piece of equipment had a problem, this is how we fixed it. So it's giving that immediate ability to fix it in the most efficient way possible using the AI, using voice, and again, communicating by like color and pattern so people can quickly see what's wrong. And that's kind of the concept that Heather and I have been working on.
That's pretty amazing. And so Heather, have you been able to prototype that or roll that out to any of the floors or the WOW carts yet? And are you getting feedback on those things?
We have not done that yet, but we are working on a potential pilot. So I'm super excited. The biggest thing is making sure that it's going to work for the different personas. So we've actually talked to some physicians. I always like to point out that, clinicians, we're not all created equal, meaning we have different workflows and different needs. So just because something works for a physician does not mean it's going to work for a nurse. So taking all that concepts and all those different workflows. But in order for us to truly understand that, we have to get out there and actually talk to the frontline clinicians. And hopefully we have an opportunity to do that soon. So excited about the opportunity we have.
Very nice.
Exactly.
And are you guys... Go ahead.
I was going to say, we're looking to get the pilot going probably a little bit later this year, probably the November timeframe. We've got new prototypes that are being manufactured right now, and then they'll be able to get them in the field and be able to use them and really get some real world feedback right away.
That's awesome. That's awesome. And so, okay, so this is one thing that you guys are doing actively today, right now. Are there other things on your mind that you're like, well, as you're talking to these clinicians and frontline workers, are they coming up with other ideas where they would like to employ AI to help them be more efficient?
Yes, I can take that one. So one of the things, nurses want AI. I mean, we know it can do amazing things, but right now it's like, let's tackle that low hanging fruit, the things that really, are burdensome to us. And I think one of the biggest wins for nurses is to ease the documentation burden. As more technology comes out, as there's more protocol, standards of care, it creates more documentation for nurses. I read a very scary stat recently that I think most nurses in just a 12-hour shift, now, as you know, nurses typically work longer than 12 hours, but they are spending at least 8 hours per shift documenting. So nurses feel like, they're data entry clerks now. Like, I went to nursing school to be a data entry clerk, and the computer is now my patient. So I really feel that nurses, you can win them over big time if we can ease that documentation burden. I think AI has the potential to do that.
Yeah, I would agree. And I think I shared on another episode that my mom was recently in the hospital, and we saw that, the nurses, they were doing their best to make sure that they had the rounds and were but they spent a lot of time at the computer doing that documentation. Okay, so Eric, when we think about this, and I mean, I'm sure you're doing this because I'm doing it right now too. Like, okay, I think I can solve that problem. Let's do it. Like, what are your ideas when we start thinking about solving that documentation problem?
So the nice thing is the same concept of having basically an IoT device or a device that now you can have that natural conversation with. And another really interesting thing that we're looking at is we can put, again, in these devices, we have speaker and microphone, so we can have conversation. But interestingly, of course, and again, there's HIPAA issues and privacy issues, but there's also chips now that can listen. And not just listen, so they can listen kind of Alexa-like. And so if the nurse wanted to dictate, because it's tied to that device, that WOW card, she could actually now just start voice interacting and having that, doing the documentation, excuse me, just purely with a conversation.
Yeah.
But in addition, another cool thing is that there's actually a chip we're looking at right now that actually will be able to listen, and it will also be listening for faults for the computers as well. So if it's actually listening for error codes, fans going out, keywords being said, and those things. So it's kind of passively going to be helping them with those systems. But then again, also having that AI chatbot kind of ability to be able to have that AI personal, perfect assistant, so they can have the documentation done and have it ask the questions. One of the things that I think, Carmel, we've talked about before is with a lot of systems, one of the hardest things is to get people to put data in, because I've got fields to fill in.
Right.
But what if you were just being asked those questions? And only the ones that made sense and were relevant, and you're just asked those questions. So that, I think, is really where we're going. And that's kind of the concept, is if we can have that AI not just, dictate, because that's what we do today. We're doing dictation. Right. But what if it's actually doing contextual understanding and questioning to go, okay, so you didn't mention the blood pressure. What's the blood pressure? You did, things like that. So that's where I really see it also becoming really exciting.
Yeah, I mean, I think we're right there, right? I mean, we've talked about this. I mean, I've talked about this at conferences. I think today, as you mentioned, we initiate the discussion with chatbots. Tomorrow, they're going to initiate the discussion with us, which is going to be, to your point, and what a great use case this is, right? So, yeah, you're a nurse, you say, okay, start dictation, go. You say all the things you're going to say, and then stop. And then the chatbot is telling us, hey, you forgot these 4 things that are required as part of whatever documentation you need. That's brilliant. So Heather, if you brought that solution to the nurses, would they be like, this is awesome? Do you think?
I believe so, but it's all about how we message it too. So I don't know if you guys have heard, some nurses aren't a fan of AI because they don't trust it. Nurses from Kaiser recently, not too long ago, protested, and they were holding signs up that said, trust nurses, not AI. Well, you can't replace a nurse with AI. So it's all about how you educate and message it to them. So I always say, introduce AI to them as, hey, here is another nurse tech. Here's another assistant to help you. Oh, they would all be jumping up and down for more nurse assistants, wherever we can get the help and ease that burden. So I think that's key. And just making sure they have a seat at the table, their voices are heard, and they're educated. And I think nurses would love to trust AI, but I mean, our voices haven't been heard. We have not been given a seat at the table. So we have to change that.
Yeah, for sure. I think that's insanely important, because doing AI for AI's sake without getting feedback and input from the people that are going to be using it is a huge mistake in my mind. And I think if somebody's doing that, and I'm going to say to you, that's not the partner you want to help you implement AI. Yeah. I also think, it's interesting. There's a woman we work with who's been on the show. Her name is Lauren Renninger, and she says all the time, you're not going to be replaced by AI, but you're going to be replaced by somebody that works really well with AI, right? And so I think that education and the change management around AI is so important as we continue to see more and more use cases, so that folks really do understand this isn't about replacing you. You're insanely valuable. We just want to make sure that you're doing the thing that we really need you to do, not 8 hours of documentation as a nurse, right? So I think that's brilliant point there. And Eric, I think you were going to chime in with something also.
I think that's just what the key is this concept of it really being an assistant. Right now we're seeing in large systems like the ERP systems, Microsoft's ERPs, and where now when you look at a customer screen, or you can imagine this patient, you look at the patient, it's going to give you basically a quick summary of what is the most important thing about this patient. And so if they're a diabetic patient or whatever those issues that it knows about, that it wants you to know about, it can bring that up and just lets you know very quickly and easily. And as you said, it's just there to augment. I actually wrote something back in 1982 when the personal computer was supposedly going to get rid of all of office workers. And I said, no, you're going to just have computers do more, and you're going to create an entirely new industry, which is we created the IT industry. Right. So just now, same thing. We're creating the AI industry, and exactly as you said, Carmel, and as Laura says, it's going to be the people who know how to do the prompts, to have the conversations, are going to be the ones who are going to be most effective.
Yeah, exactly. Okay, well, I mean, exciting times that we're living in, everyone. Okay, so what about it? I mean, have you guys thought about any other use cases, or is there, like, I know we've been primarily focused on nurses, but do doctors also have some use case that we should be considering that maybe we haven't talked about yet today?
Real quick, I can talk real quickly about that. One of the concepts that we're also talking about with with Heather, is the concept of using the same devices, but now having them on, because really what the device is doing is showing you a resource's availability and status. Mm-hmm. So you can just look, that one's working, that one's not, that one's available, that one isn't. So now imagine if in that same hospital, there was also those same devices, IoT lights devices, on the rooms. So now you can just look at a room and see, a doctor can look down and see that next room in his exam is where he needs to go based on the color and pattern. That room needs to be remade because it's got this. A technician could look down a hallway and see that there's a small red light on the top of that in that room. That means that somewhere in that room there's a piece of equipment that needs to be fixed. So again, doesn't have to have a computer, can look at that. Now, one of the things we're also talking about is if we can now know the scheduling of that room, because now if we can tie to the patient management system, automatically know who's in that room, what has to happen, what procedure, and we're communicating it through APIs to those different systems with the color and light. Now we have that ability to start figuring out scheduling. One of the things that drives me crazy, especially for doctors, is they schedule everything in 5-minute, 10-minute blocks. Years ago, we did some AI that looked and said, could basically look and say, for this particular doctor, when he sees this particular patient or this type of patient, does this procedure or type of procedure, how long did that meeting did that actually take? So now when I'm scheduling, letting the AI use all the variables it can to maybe that's a 15-minute appointment. This is a 6-minute appointment. And let the AI now optimize scheduling. One of the doctors we're working with has an ophthalmology clinic, and one of the big clinics in the East Coast has an average 4-hour wait time, just because they have trouble shifting people in and out of rooms and moving between equipment and using using the proper scanners and all those things. So that's where I think there's a huge opportunity to use AI.
That's
Heather, I know you've got some concepts on that too.
Oh, so. I would agree for sure. You use AI to optimize resources and clinical scheduling. As a former manager and charge nurse, doing the staff scheduling and making sure that you had enough staff with the right competencies and skills that to match the patient population. I would have to log into probably 6-7 different systems. Nothing talked to each other. I was constantly chasing my tail with dealing with understaffing. So, and understaffing equates to worse outcomes, and not the best patient care. So if we can optimize that and have the augmented intelligence to help the nurses and nurse leaders make sure that they have the proper amount of staff so that, staff don't get burned out and that patients are receiving the best quality care. I think that's a big win. That's another big use case I think could really make a difference in healthcare.
Yeah, I mean, I think we're seeing that schedule optimization in other industries as well, right? And I'm almost surprised that healthcare hasn't done it before now, just because, I mean, patients have to be complaining about a 4-hour wait time. And I mean, I know I complain when I have a 20-minute wait time, right? Like, I don't have time for this. So I'm going to go. Call me back later. But I mean, that would be an amazing experience, right? If you got to a doctor's office, whatever kind of doctor's office, and you were able to just get right in because they understood the patient backlog before you and how much time each one of those was going to take in a more accurate way. And then how long yours was going to take also. Yeah, amazing stuff. Okay. Well, I mean, I feel like we should all just go build these right now and make sure that they're available. Any other ideas that you guys have, or anything else you want to like sort of talk about from a healthcare AI perspective?
Yeah, I have something to mention because I get really excited about it because a bunch of nurses came up with this. So I believe healthleadersmedia.com would have this for you guys to read about, but they came up with the 5 rights of AI in healthcare framework, which is kind of mirrored off of, inspired by the 5 rights of meds, to really make sure that nurses have a seat at the table, that the AI tool is going to meet the needs of clinical care. So I think it's a great framework. If no one's heard of it, please go out and Google it. But it's pretty simple. Identify the right objective. What are you trying to solve with AI? So what's the problem? What's the right approach? The right competency. You have to make sure you have the right competency on the team with AI. The right data, which is critical. I think that's the number one. Leaders need to understand how the data is being sourced, interpreted, and understand how the AI was trained. And then lastly, the right safeguards. You have to make sure it's been tested. You have to understand how it works. Has it been checked for bias, and ensure that all these steps were taken before it actually gets implemented and used in clinical care for patients. So
yeah, and frankly, I would say that applies to every industry. We should be doing that. So
I agree.
100% agree. I think Eric mentioned also that back in the day that everyone thought the computers were going to take over the world, and now we have IT. I think what we're going to see, because you mentioned data, Heather, what we're going to start to see is we've been all talking about big data for 30 years, right? And while companies have data governance policies, we don't do a good job of the custodianship of that data and managing it and learning from it and doing the care and feeding that we need to in order to make it useful to us. And I think as we start seeing more and more large language models and generative AI and then predictive analytics, that is going to be a new role that we see in organizations as well. Not just around healthcare, but in general. But I see it in healthcare in a major way. I mean, I read somewhere that healthcare produces the most data. You could fill up 99 football fields with those 1 terabyte cards, 99 end to end, right? Like it's an insane amount of data that people have to manage and look at and trudge through. I think that's another area. I don't know if you all think it so, but I think that's another area that would be really interesting for healthcare, because you have all of this data and people are mining it on a regular basis. If we were able to do something to help mine that data and really access it in a better way for coding and reporting and all the rest of that stuff, I think that would be super interesting.
Interesting. And with that stat you just mentioned, that the majority of that data goes unused.
Yeah.
It's all the value it could be bringing if we knew how to mine it, like you said, and source it and leverage it the right way in the right format so that we can take action on it and learn from it.
Yeah. 100%. Eric, I think you wanted to say something too, or no?
I think that's so very important, is just being able to do that. And one of the concepts that I think Carmel, I also mentioned, we've talked about before, is I would love the concept of an AI that its job is basically, each person has a bespoke AI that its job is to basically help optimize their life, optimize their health, optimize their physical, mental abilities, and also protect their data, protect them from government and corporation. Make basically individual AIs basically containerizing your data and monetizing your data for your benefit, protecting it, and then also being able to look at your genetic code and go, because I think, as many of you know, so many medications don't work for large amounts of people based upon their genes and genetics. So we did the number to treat, what gets prescribed and what's actually useful and helpful and valuable to people is a really small number, because we were not looking at all that data we have. If we could look at the data and uniquely treat people with the proper medications that do work based upon their genetics, based upon all of the other information we can gather, that's when I think we start to really get to really super valuable healthcare.
Yeah, that would be amazing, right? Like, yeah, that's incredible. You think we're gonna get there in my lifetime? I'm old, man.
I do what I was my saying, I've been saying for many years. I've done a lot of work with AI and longevity. I used AI many years trying to look at basically slower reverse aging. I always say we have to live long enough to live as long as we want to.
Yeah.
Because we basically have to get to the 2035, 2040, when I believe that's the time when, like Ray Kurzweil and many of these others feel we're going to get to this inflection point in the technology with AI, that we're going to really be able to now kind of transform health. So that's kind of the excitement there. We basically just you gotta hold out and make it to when we can actually start really having these things make huge effects on our health.
Yeah, awesome, amazing. Okay, well, I mean, I think if anybody has any parting words, I think this has been amazing. And Heather, thank you so much for being on the podcast. Eric, thanks for joining me again. And I mean, just a really exciting time to be in technology and in healthcare and starting to see these things come to fruition, both on the back end, on the patient, and on the caretakers, side of the fence. I think it's apparently we have a little bit longer to wait, Eric, but we're making good progress there, right? So love to see that. All right. Well, we'll wrap this up. Again, thanks everybody. And next time on AI Got This, we will be deep diving into so look forward to seeing y'all then. Thank you.